Welcome to Health Talk with Dr. Mutiat. My name is Dr. Mutiat OG, Dr. Mutiat Sunshine. You're welcome. As you can see, I'm not feeling up to it today. My body is tired. I am exhausted. But I have been in bed the whole weekend, and as soon as I'm done doing this, I'm going right back to bed. Once in a while, we also need to listen to our body. I exercise, I work out, I eat right, I do everything I'm supposed to do. And also my body sometimes just wants a day or two or three of laying down and doing absolutely nothing. And I shall oblige. It doesn't mean you're lazy. It doesn't mean you're supposed to be doing something. When your body requires total rest, please oblige and give it a total rest. So that's this morning's spiel. Good morning. Thank you for joining me. This week, we're going to be talking about cervical cancer and the HPV vaccine. Throughout the week on Facebook, this week, even though I've not been active because work has been busy, I've seen a lot of people discussing HPV, talking about cervical cancer awareness. It is Cervical Cancer Awareness Month. So it's only fitting that we talk about this today. If you are seeing this, if you are watching this, please take this opportunity. Please take this opportunity to share this video, to like, to engage with this video. So that way you encourage me to keep doing this. With no engagement, I'm like, people don't need it, and I will give it up and stay in my bed and mind my business. So please, share this, engage with it. Let me know you're watching. Let me know you're listening to me. Let me know you enjoyed me doing this. If not, don't worry. Promise you, I will always go back to my bed. Always a good day to go back to my bed. All right. So we are going to start. Okay. We are starting. Let's see. No comments yet. All right. Before I get started, I have had some questions about this, and I will try and talk about them. I've had people inbox me asking questions about this, and I'll try and get to them during this video. Okay. So cervical cancer. All right. Did you know that cervical cancer is, I think, the 4th most common cancer in the world, and also one of the most preventable ones? Very preventable, and it's the 4th leading cause of death. All right. So, it's women and men. Actually, cervical cancer is for women, but HPV causing cancers, also men can get that also. So all of us in general, we need to care for our health. Okay, we need to care for our health. So very, very preventable. So please, and in this video, we're going to talk about the risk factors of having cervical cancer, how to prevent cervical cancer, screening, and your treatment options. As we know, I really don't delve into treatment options because I don't trust y'all. Because y'all just gonna start doing things in the house saying Dr. Mutiat said no. So I don't talk about treatment options, but I'll talk about screening, I'll talk about risk factors, and I'll talk about how to prevent it. Okay? All right. So basically, cervical cancer is when we have some abnormal growth of cells in your cervix. Now, women, we have a uterus, we have a cervix, we have a vagina. If we don't, well, I will find, if you don't know where your cervix is, inbox me. I'll find you a picture to show you. I can't do that because Uncle Mark will ban me. So, and I don't want to be banned. So I can the last time I put a video about doing a testicular check, I got banned. I got censored. So I'm not going to do that this time. But if you inbox me, I will tell you what your cervix is. So, that's it. You have your uterus, you have your ovaries, your fallopian tube, uterus, and then next is your cervix. And then from there is your vagina and all that good stuff. All right. So cervical cancer, like I said, is the 4th leading for women cause of, 4th most common cancers for women. And cervical cancer is when we have abnormal growth of cells in the cervix. Now, abnormal growth, the key word is abnormal growth. All right, abnormal. We have cells in your cervix. You're supposed to have cells in your cervix, of course. But when they're growing rapidly and abnormally, most of the time, and when we biopsy that, it may be cervical cancer. So it's one of those, all right? And one of the biggest causes of cervical cancer is HPV. Human papillomavirus. It is not a new virus. Before everybody's like, hey, it's the end of the world. That's not a new virus. No, HPV is not a new virus. For them to have vaccine for it, it is not a new virus. Human papillomavirus is one of the major causes of cervical cancer. I think it's HPV. There are different forms of HPV. There are different types of HPV. We have HPV 30 something, but right now the one that's responsible for causing cervical cancer is HPV 16 and HPV 18. Those are the ones that causes cervical cancer. But there are other HPVs. HPV 37 is a lot. 31, 33, 35, 39, 45, 51. It's a lot. The other ones too may cause it, but the ones that we see often that causes cervical cancer is number 16 and number 18. Okay, I'm going to look through, make sure there are no questions. All right, beautiful. All right, Miss Shola, thank you for joining. Glory Baby, thank you for joining. Miss Esther, thank you for joining. All right, I'm interested in particular topics because of you and your girls. Beautiful. If you have any questions, please let me know so I can delve into it, because I unfortunately may skip over some topics some things that are important to you. So if you have any questions, if you don't want to ask it here, please feel free to send me an inbox and I'll answer your questions for you. All right. Okay. So, like I said, one of the biggest causes of cervical cancer is HPV vaccine, HPV virus. And unfortunately, it may be transmitted through sexual activities. Now, keep in mind, it may be transmitted through sexual activities to people. Now, we try to give, okay, I'm going ahead. I'm going too much. No, I'm going too much of ahead. So that's that. Okay. So what are the symptoms of having cervical cancer? How do you know you have cervical cancer? Number one, I always tell people, know your body. Know your body. If you're one that have a light period and all of a sudden your period starts getting heavy, go to your gynecologist. If you're one that never have pain during sex and you start to have pain during sex, go see your gynecologist. If you're one that don't have breakthrough bleeding between your period is 28 days, and from 128 days to the next one is bone dry, and all of a sudden on day 11, day 12, you're seeing blood, go and see your gynecologist immediately. If you start noticing some vaginal discharges, you never had, we have vaginal discharges, women, based on the ebb and flow of our hormones of our period. We will have sometimes that we're bone dry, and we have sometimes that we have discharges. Now, if you notice some discharges, trust me, if you know your body, you'll know this is not usual for me. The color of my discharge has changed. So if you notice that, go see your doctor. So what are the symptoms I said? Vaginal bleeding. Also, if you notice bleeding while you're having sex and the sex is not rough sex. If the sex is not rough sex, okay. But if the sex is not rough sex and you're having vaginal bleeding during sex, go see your doctor. All right. If you notice that your period got heavier than what it normally is, go see your doctor. If you notice that you're having some vaginal fluids, some vaginal discharges that you never used to have, go see your doctor. And if you're having pelvic pain, especially during sex, pelvic pain that's not related to you having ovulation, that's not related to right before your period. If you're one of those, you're lucky few that don't get pain during your period, God bless you. I envy you, because my period be perioding. All right. So if you notice that, also please go see your doctor. All right. Now, what causes cervical cancer? Okay. Again, like I said, it's an abnormal growth. Like you will have cells replicate slowly by slowly, normal. If you shed, you get another one. You shed, you get another one. But when you start noticing, when it starts to grow abnormally, it's the beginning of cervical cancer. It's mostly from a change in DNA of the cells. Like if your cells have DNA, it's a change in those cells. If they've changed, then, unfortunately with most cancers, that's it. Most cancers is a change in the DNA of your cells. What causes those changes? We don't know yet. There's still studies out there. There can be mutation. It may be genetic, inherited. We don't know per se what causes it. It can just be all of a sudden your body just changes. We don't know per se. So this is why we ask people to do frequent checks of their body. You need to go see your doctors for all your checks. So that's how we catch things, because we don't know when things has changed in our body. All right. So like I also said, a change in DNA that we don't know the cause. And also another cause of cervical cancer is HPV, human papillomavirus. I've talked about it earlier. It is not a new virus. It is a virus that unfortunately may be transmitted during close bodily, during sexual contact. All right. So it may be. All right. We have different types of cervical cancers depending on where they arise from. So your doctor knows that, and they will treat you accordingly. You don't need to know that. Okay. So what are the risk factors of you having cervical cancer? Smoking tobacco. If you smoke, quit. Smoking causes a whole lot of things in your body. Quit if you smoke. All right. If you have a high number of sexual partners, decrease them. I'm all for body's positivity. I'm all for sexual liberation. I'm big for that. However, because it may lead you to, unfortunately, things you don't want, like, even with condoms, it's still possible, because your body will still, it's still possible to unfortunately be exposed to these things. So reduce the amount of partners you have. All right. Also, some research has shown that if you start having sex early, you may be exposed to HPV. All right. If you've had any other sexual STIs, any other sexual transmitted diseases or infections like gonorrhea, syphilis, chlamydia, HIV, herpes, you are at an increased risk of having HPV. And also, if you have any weakened immune system, if you're taking all these agbos or whatever that you don't know what they do for your body, and you weaken your own immune system and you're unable, and you'll be taking antiviral unwittingly, you'll be taking antibiotics unwittingly. We talked about this, why you should not be doing this. If you're taking all these things that protect your body, you're not letting the good germs of your body do their jobs. You weaken your immune system. All right. So how do we prevent? Do we have any questions? Do we have any questions? Auntie Muiba, hi. My auntie is on. I'm trying to see if we have any questions before I move on. Please let me know if you have any questions. All right. So how do we prevent HPV? Like I said, how do we prevent cervical cancer? Like I said, it's the 4th most common cancer for women, and is the most preventable one. How do we do that? Take your HPV vaccine. I'm going to explain to you later about HPV vaccines, and also for your children, ma'ams and sirs, your boys and your girls. Boys also carry HPV, although they may not have cervical cancer, they may end up having anal cancer, and anal cancer is not reserved for gay people. No, anybody can have anal cancer. Anybody can have it, because this person doesn't mean, oh, they're gay and that's punishment. That's bullshit. Please take that mindset away from me. That is unacceptable. So your boys and your girls should be vaccinated for HPV vaccine. They should be vaccinated with the HPV vaccine. And the fact that they're vaccinated does not mean they're going to start having sex unwittingly. No, it does not say, oh, because you have the HPV vaccine, my kid is going to start having sex, so I'm not going to give it to them. You are still exposing them. You're exposing them, unfortunately. All right. For women, we need to have routine pap smears. People, tell me in the comment, when was the last time you had your pap smear? I want to know. Tell me in your comment. Do you even know what a pap smear is? What it is? Tell me in the comments. I want to read. I'm reading right now. Tell me right now. When was the last time you went for your pap smear? And do you even know what a pap smear is? Other women in the comments, let me know. I'm listening. I'm reading. I'll sip my water while I wait. I'm reading. No responses? No responses? Nobody's responding to me? Does this mean we have not had a pap smear? Ladies, we need to go for a pap smear at least every, I think yearly, and every 3 years for anybody over 35. But at least, I'm not a gynecologist specialist, but go and see a gynecologist and get a pap smear done. And let me see. 2 years ago, it's a 3-year scan. Oh, perfect. Good. Yeah, I learned pap smear is done for 40 years. No, everybody younger than 40, that's when you need to start having pap smear. Younger than 40, you need to start having your pap smear as age 21 and up. If you start having sex early, you start having pap smear early. Pap smear, because that's the only way the doctor can lay eyes on your cervical cells and see if there's something going on. You need to have it done. If you have it, I mean, most places do every 3 years. Most if you don't have any abnormal cell. But if they cite an abnormal cell, you go in yearly for your pap smear. So 2022, we're in 2025, you are due now, ma. You need to get it done. Even I that I'm talking, I need to go get mine done. I need to schedule mine. It is time. 3 for yearly, then 49. Exactly. I think US standards are different. You know what? Let me just quickly check. US standard is different. We do yearly. Yeah, ACOG. Let me see what the ACOG says. Beginning at age 21, yes. But for the US, according to the American College of Gynecologists, Obstetricians and Gynecologists, ACOG for US, we need to do you start screening at age 21. You from age 21 to age 29, you test alone every 3 years, and we do a HPV test every 5 years. So you go HPV, they test it for HPV every 5 years, and you do pap smear every 3 years. From age 30 to age 65, you are at the same time doing You're at the same time doing every 5 years. You're doing HPV and pap smear every 5 years for 30 and 65. And over 65 is when we discontinue if you've had 3 consecutive normal pap smears. All right. Okay, they've changed the thing because the last time when I was in school, it was yearly. So they've changed. ACOG has now brought a new one. All right, perfect. So, yeah. Yep, I'm looking at ACOG website right now. So, yeah, they have changed it. They changed it last year. So anybody younger than 21, you don't need screening. But I still say, please see your gynecologist. 21 to 29, 3 years. 30 to 65, 5 years. HPV test in 5 years and over that. All right. So please go see your gynecologist. They are more specialized in this. They can help you better. I'm not into gynecology. I don't do anything gynecology. Anything down there, I don't do. I go see my own doctor. Yeah. Ms. Bimbo, yes. I just double checked for the US. I think US and for ours is 3. US and just the age is different. All right. So how do we prevent? We were talking about prevention. You ask your doctor about HPV vaccine. Again, like I said, boys and girls get HPV vaccines. All right. You have routine pap smears. Please go get your pap smear done. Every 3 years, you got to get it done. Practice safe sex. Okay. Make sure like I said, I'm all for sexual liberation. Hey, do you live your life if that's what floats your boat? However, understand the consequences to your actions. Understand that unfortunately you are exposing yourself in things you shouldn't be exposing yourselves to. So practice safe sex and don't smoke. Stop smoking. If you smoke, you need to quit now. Don't smoke. Biko, stop smoking. It is not good for you in general. Stop it. All right. So how do we screen? Like I already talked about, we do pap smears and we do DNA testing for HPV to make sure you don't have those 2 major causes of cervical cancer. Now, I'm not saying barring these 2, you are never going to have cervical cancer. Unfortunately, some bodies are bodying, for lack of a better word. Some bodies will do what they need to do. So you still need to make sure you go get your pap smear done so your doctor can lay eyes on your cervix every 3 years. All right. So how is it diagnosed? Anything that's cancer, the way is you have to do a biopsy. Your doctors will go in there, take a sample of the cells, send it to the lab. And unfortunately, if it comes out positive for cancer cells, they immediately start treating you. It depends on what you want to choose. You have radiation, you have chemotherapy, you have surgery, depending on how far your cancer has spread. So if it has spread all over, then surgery is out of running. So we're stuck with chemotherapy. We need a systemic. But if we have a smaller space and if it's too big for surgery, then we might have to go for radiation. Again, this is something your oncologist will discuss with you. In an unfortunate way, that you do have, cancer. All right. Now let's talk about HPV vaccinations. All right, where's my notes? Okay, all right, HPV vaccine. We've had it for a while, all right? Before it was only for people under 30, but up until recently, the FDA just literally approved it for people up to 45 years old. All right, so it was just approved for people up to 45 years old. So it's a discussion you want to have with your gynecologist. This is why you need to keep seeing your doctor on a regular so they know who you are and they can advise you based on who you are. Mutiat cannot tell you everybody should get it. I don't know your medical history. But if you have your own gynecologist, you will go to them and they will keep Keep in mind, you keep hearing me say gynecologist, not OB. OB is for when a woman is pregnant. Gynecologist is not when you're not pregnant. So that's why I kept saying gynecologist. Although both of them work, like most doctors that are OBs are gynecologists, but there are some doctors that are only pure they're pure gynecologists, or some of them are pure OB doctors. But most of the time, they are most OB gynecologists. So make sure for this situation, you're seeing a gynecologist. And then, God forbid, when you're diagnosed with cancer, they will refer you to a gynecologist, oncologist. Those are doctors that specialize with gynecology cancers. So anyways, back to HPV vaccine. HPV vaccine is recommended for girls and boys at age 11 and 12. The best time is for when they are, doctor, what age? Yes, 11 and 12. I didn't even read it before I started talking about it. 11 and 12, before they start having sex. You want the vaccination. Vaccination is prevention. So you have the Ajesara, for lack of a better word. That's the easiest way that pops in my brain. I'm Yoruba, so it's like Ajesara to prevent this from happening. Should you be exposed, you already have your own military that can guard you. That's why we start early. So for boys and girls, ọkùnrin àti obìnrin wọ́n ẹnu okay. I started learning Igbo. So let me know if I said it right. So for boys and girls, okay, okay, or make sure they're vaccinated by age 11, age 12. And that doesn't mean because they're vaccinated doesn't mean they're going to start having sex. So please do not have that mentality ruin your child's life. Okay, once the person has been infected, HPV vaccine really doesn't work. Vaccine is Ajeshara, it's prevention. It's not a cure, it's not a treatment. The vaccine is to prevent, it's not to treat. Do you understand me? It's, God forbid, when you're exposed to it, then your body can mount defense against it and be like, out. That's why we get vaccines. But once you have HPV infection, the vaccine can't do anything. Okay? You are right with the Igbo. Okay, Glory, you are not Igbo. So you can't tell me if I'm right or not. But I understand. All right. Teens and young adults from age 15 to 26 also will receive the vaccine. I think it's 3 vaccines. I don't know how it's spaced. Again, I'm not gynecology, but I just know it's 3 vaccines and they will get that vaccine. And like I said, it has now been approved for people up until age 45. Male and female, boys and girls can get the HPV vaccine because while men cannot have cervical cancer, they can have other forms of cancer that is caused by HPV, such as anal cancer. Or some head and neck cancers actually caused by HPV. Okay. Now, let's see. Is there anything else I wanted to add? I think I've added everything I wanted to add. We've talked about that. Now, let's talk about some potential myths that, most people think HPV only affects women. Lies. We already know that, right? HPV does not only affect women, it affects men and women. Only sexually promiscuous people get the HPV vaccine. No. You don't know. No. It actually, I don't want to scare you, but sometimes skin-to-skin contact also can transfer HPV vaccine. So you don't have to be sleeping with people. That's why I said even sometimes condoms cannot help you. Because, whoever you dilate or whoever, comes close to you. And I'm talking actual skin-to-skin contact. I'm not thinking handshake, hug, not that level. Like I'm talking actual skin-to-skin contact. All right. HPV vaccine is only for young girls. No, I'll keep singing it in your head. Boys and girls get HPV vaccine. The HPV infection always leads to cancer. Not necessarily. It is a high risk factor of causing cancer. We've seen it more often than not, but doesn't mean you have HPV vaccine automatically you're going to have cancer. No. Some people it lays dormant. There are other things in your body with the HPV in conjunction with the HPV vaccine that may lead to cancer. Not everybody that has HPV will have cancer. If I'm vaccinated, I don't need screening. My dear, you need screening. Once you get vaccinated, you still continue your pap smear. You need screening. You are not exempted. You will still be screened. Every year, every 3 years, you go for your pap smear. All right. Testing is for only women under 30. That's not true. At age 21 and up, we start testing. We start testing for HPV. All right. So everybody must get tested. Men don't need to worry about HPV. What did I tell you can happen with men and HPV? What did I tell you? What kind of cancer? I've said it several times today. What kind of cancer can happen with men in HPV? All right, are we paying attention? I'm reading the comments. Give me the answer. Give me the answer. Give me the answer. Give me the answer. What kind of cancer happens with men with HPV? Anal cancer. Thank you. Anal cancer. And it doesn't mean they're gay. So get your mind out of it. When you hear someone has something, anal cancer, oh, they are because they have done something. No, that's not the reason. Get your mentality checked. All right. Get your mind checked. And no, that's not the reason. Okay. All right. And I want to share a story. It's on my health talk on the page. I got an inbox from somebody. I think a couple of years ago, I talked about cervical cancer and having people go get tested and all that. And this person listened to me. They went to get tested. They went to do their pap smear, and unfortunately, they found some. It's written on there. They found at the base of the tongue. Yes, you can. Thank you, Miss Maureen. Yeah, head and neck. Yeah, Miss Bimbo. Thank you. Head and neck. Throat cancer can be caused by HPV. So a lot of things can be caused by HPV. But back to the story of the person I was telling you, they went and got done. They did their pap smear, and once they did their pap smear, unfortunately, they found some, abnormal cells, which they had to go for excision for. And luckily, God bless them, and grateful to God, it was not cancer. But this person was put under the doctor's care, and they have to check them every so often to make sure they don't develop into cancer. There's some cancers in your body that you don't know is growing. A lot of things you don't know is growing. Medicine is not the point that we can see and tell you, oh, you have this, you have that. No, we have to look inside you to see things growing. And if you don't know your own body, I always say this, know your body. If you don't know your own body, you won't know if something is wrong. You can't just go to the doctor and say, my pinky is wrong. Okay, what was your pinky looking like before? Everybody is not normal. Like some people's pinky is always like this, but then they wake up one day it's like this. It's a big deal. It's a big deal. So each person is different. So you have to know your body so you can tell your doctor, oh, doctor, my pinky hurts, but yesterday it wasn't hurting. I noticed it's been hurting for 10 days. Things like that. When you tell your doctor, and then we can work on it. You just don't walk to the doctor at the last minute and expect them to perform miracles. It doesn't work that way, sir, ma'am. You need to be responsible for your own body. Doctors, nurses, healthcare professionals are not responsible for your body. You are responsible for your body. All right. So let's see. All right. I think that's about it. Do we have any questions? Nah, this woman is glowing. I better come out. Ibere is always looking for my trouble. Neck and anal. Yes, Miss Shola, you're right. When I was getting checked, the lady said, and yep, this person could have been exposed. Yep. And have not tested. If this is true, wouldn't it be a wasted effort to take the? But again, you don't know that you were exposed. You rather have the vaccine. That's why we start the vaccination early, at age 11, age 12. You rather start early. Once you start early, again, that's why we start the vaccine early. It's not a wasted effort to get a vaccine if you don't know you've been exposed. How would you just make that decision like, oh, I may have been exposed, so that's it. I don't want it. No. If it's available to you and you can get it, get it. Rather be safe than sorry. If you have the vaccine, God forbid you've been exposed, at least you've done something to protect yourself a little, even if it's a little bit, it might still work. You don't know. So get the vaccine. Don't rule yourself out. Again, and also speak to your own primary doctor. Speak to your doctor. They can give you best advice based on your body. This is not a decision you can make by yourself. I know it's your body and you make that decision, but you are also not learned enough to make that decision yourself. You have healthcare professionals that have backed in research, backed in science, will tell you what's like. They will offer you the best option for your body. It is now up to you to take that decision, but we'll offer it to you like, this is what we know based on you, based on your medical history, based on science, based on what we've seen, based on research. This is the options that you have available. Now it's up to you to make that decision. All right. Let's see. Because they don't know, because they don't test. Yes. So HPV in common is very common. Yes, it is very common in Nigerian women, Nigerian men and women. But we don't know because we don't test. A lot of things are common in our body. But again, we don't test. We don't go see our doctors. You wait till God forbid something is wrong. And then you start running helter-skelter. A stitch in time saves 9. Early prevention, early detection is key. If you go, unfortunately, with all these cancers, the earlier you detect them, the more better your chances of getting healed and getting cured. Yes, some cancers are actually curable. Cancer is not a death sentence. It is not. So some cancers are very curable if you find them early. If you find them early. Keyword is early. Early detection. And how would you find things early? By going for your yearly physicals. Yearly physicals. You need to go for yearly physicals so we can find things early, take care of them immediately. All right? I see myself on the old pics behind you. Yes, you are here. That is true. Yeah, you're here somewhere. That's true. You're there. You are there. The old days. Yes, so we go way back. All right. So do we have any questions? It is 11:30. I don't want to. Doctor's even teaching us Igbo. I've been now. I'm learning Igbo. I want to be an Igbo girl so I can be gossiping with Ebere, with you guys in here. So I can be gossiping very well with Ebere. All right. It's been a pleasure. Again, let's just wrap this up. Cervical cancer, it's a preventable cancer. We prevent it by taking HPV vaccines and also going for your pap smear. Early detection is key. In the unfortunate chance that you get diagnosed with cancer, early detection is key. And some cancers are curable, but you have to find them early. Make sure you schedule your appointment with your gynecologist and get your pap smear done. Pap smears are done every 3 years if you're under age 30, I think. And over age 30, it's every 3 years. Let's just put it that way. Every 3 years. And they will also run some tests with that. But if you don't go to your doctor, all this will not be done. All right. HPV vaccine is very effective. Your regular screenings are non-negotiable. Early detection, I've said it 10 million times, saves lives. Please make an appointment with your doctor. Go see your doctor. And please share this vlog with everybody. Why am I hungry? The palm oil soup. Why am I always hungry and craving your food? That palm, madam, move to the side. I have not cooked in a while, Berry. I have not cooked in a while. I'm not hungry. But I have to cook something. But maybe I'm thinking of frying puff this afternoon if I have energy to crawl out of bed. But that's that. But anyways, please share this video share. You never know anyone that might need to hear this information. Don't gatekeep me. I've been asking you for that. Don't gatekeep me. Don't keep it in your pocket. As you're learning, let other people learn from you. Let other people learn. And you never know whose life you're going to save by just sharing this video. All right. It's been a pleasure. One more time. My name is Dr. Mutiat Sunshine, Dr. Mutiat OG. It's been a pleasure, and be safe, be well, enjoy your week, exercise, and live well. Dr. Sunshine, signing off.